And then now let's move to the next talk. Well, also linked to obstetrics, FitMum. It's again from Copenhagen. Caroline Roland has been willing to update us about what I think is a very remarkable study, and you will hear more about this in the talk. So, Caroline, the stage is yours.
Thank you very much, Martin, for the introduction. Can you all see my screen now? Yeah, great. So thanks a lot for inviting me to talk about the randomized controlled trial that we did in Denmark at Nordsjællands Hospital, a bit north from Copenhagen. My name is Caroline Borup Roland, and I'm a postdoc at University of Copenhagen. And as a PhD student, I have been involved in this randomized controlled trial, where we tried to investigate physical activity during pregnancy to improve maternal and offspring health. So let's see if I can shift here. Yeah. So the background for the FitMum project was that insufficient physical activity is a global health challenge among the general population. This map shows the prevalence of insufficient physical activity among women in general, but the same pattern of high prevalence occur among pregnant women as well, despite that it is nowadays quite well established that there are great health benefits both for mother and child if the mother is physically active during pregnancy. If we go to Denmark, we see that the prevalence is that more than 60% of the pregnant women are insufficiently physically active, which is less than 30 minutes per day at moderate intensity, which is the recommendations in Denmark. So so we thought it was important to try to figure out how we can help pregnant women to increase their physical activity level in order to improve health of mother and child, and in order to prevent obesity and lifestyle diseases later in life for the children. So the primary aim of our project was to investigate if we could help pregnant women, as I said, to increase physical activity level by offering them either a structured supervised exercise training intervention or a motivational counseling and physical activity intervention, compared to a control group who received standard care. So we had 3 groups in this trial. And our primary outcome was the women's physical activity level at moderate to vigorous intensity, measured by a Garmin Vivosport activity tracker, which they wore on their wrist during the entire pregnancy. And we measured our primary outcome from the women who were randomized in the study and until gestational age 28 weeks. So the population that we studied were healthy pregnant women. They were physically active less than 1 hour per week, so they were rather inactive upon inclusion. They were included as early in pregnancy as possible, but at latest at 15 weeks of gestation out of 40 weeks in total. And they were all having singleton pregnancies, meaning no twin pregnancies. We randomized 219 women in total, and their average age was 31.5 years. Their BMI before pregnancy was 24.1, so they were on average normal weight, and they were included at the gestational age 12.9 weeks. Yeah. Okay, so this is a figure of the study design, and we, as you can see here, we collected a lot of different data in this study, but what I want you to focus on today is that, can you see my mouse actually? Can you see, yeah, my pointer, yes, cool. So we had a baseline week here where they were included, and we measured their physical activity level for 1 week. Then they were randomized at latest at gestational age 16 weeks into control group, structured supervised exercise training, or motivational counseling. Then they had the interventions, if they were in one of these groups, for the entire pregnancy until delivery here, which we call visit 4. And then there were a follow-up period after that as well. And throughout the entire study period, we collected physical activity data via this Garmin VivoSport tracker. And that's the data I'm going to show you in a few minutes. But first, I would like to tell you a little bit about the content of the interventions. So as many other research projects, COVID-19 came in the middle of everything. So we have 2 versions of our interventions. One version is before COVID-19 and one is during the pandemic. But before COVID-19 lockdowns in Denmark, the structured supervised exercise training intervention consisted of, or the women in this group were offered to come 3 hours per week for a 1 hour exercise session where they were supervised by me and other students. And we trained in the gym and in the swimming pool. So that's a rather classic approach, you know, with showing up at fixed time points and training together with peers. The other intervention consisted of motivational counseling, where we took as a point of departure the participants' actual physical activity level measured by the Garmin device. And here you see a screenshot of from the app where we could see their physical activity data. So they were invited for 4 individual counseling sessions, 3 group counseling sessions, where we made individual exercise plans for them based on their actual physical activity level and what they were motivated to do, their personal wishes. And then they had to do the exercise at home on their own based on the program we made. So we tested this fixed structured approach versus a more flexible approach. But for both interventions, the target was that the women should be active at least 30 minutes per day at moderate intensity. And moderate intensity corresponds to approximately 70% of maximal heart rate. So during the COVID-19 interventions, we converted all our interventions to online versions. So the exercise sessions were conducted online via Zoom, as you see here, and the counseling sessions were also conducted online. This was just a brief overview of the method. If you're interested in reading more about all the methods, you can see the details in this protocol paper that we have published. But now to the results of our primary outcome. It's not published yet, but it's submitted lately. And what you see on this graph is that on the x-axis, you have the 3 groups: control, structured exercise training, motivational counseling. And on the y-axis, you have minutes per week of moderate to vigorous intensity physical activity. And the full lines are the average activity level from randomization and until gestational age 28, so our primary outcome. And the dotted line are the average activity levels from randomization and all the way to delivery. And you can see here that the structured supervised exercise training group performed on average 20 minutes more per week of physical activity compared to the control group. But there were no significant differences between the motivational counseling group and the control, or between the 2 intervention groups. Likewise, if we look at the period from they were randomized and all the way to delivery, we see the same pattern where the structured supervised exercise training group performed 21 minutes per week more compared to the control group, which was significant, but no differences between control and motivational counseling or between the interventions. So in conclusion, we can conclude that offering structured supervised exercise training was significantly more effective than control or than standard care, but offering motivational counseling was not more effective compared to standard care. However, even though the structure supervised exercise training intervention was significantly more effective on increasing physical activity level compared to control. We still see that the recommended level of MVPA, moderate to vigorous physical activity, was not reached, because in the structured supervised exercise training group, they were unfortunately they were only active for around 50 minutes per week, which is below the recommended level of 3.5 hours per week. So future perspectives on this is that we still need a renewed effort to try to increase physical activity level to an even greater extent among more pregnant women. And we need more research in order to be able to implement effective physical activity programs, so we can improve maternal and offspring health via those. And last but not least, I would like to thank all of you very much for listening to this talk. And I would like to thank the whole team here. This is the core group around the FitMum, or around the randomized clinical trial. We have a lot of collaborators, and especially I would like to thank Saud Alomara and Sine de Plas-Knudsen, who are also PhD students on this project. So thank you very much.
So thank you, Caroline, for this impressive presentation and the impressive body of work. So my views or my comments here are the following. So on the one hand, it is extremely nice to see such a high quality clinical trial being done without obviously any funding of pharma. Pharma is not interested in these kind of things. They don't have any stake in there. And it's good to see that funding is possible for these kind of trials in your country. And if I remember correctly, 10 or 12 years ago, there was also a Cochrane review about physical activity and exercise in pregnancy. And the essence was there are no high quality data out there. One has the impression people or pregnant women are doing not enough, but one has no idea what is the right dosage and how to implement this. And you, I think, have answers for these two questions. And I'm sure in the next Cochrane update, this paper is going to be listed on a prominent place. You know? And thanks, Ylva, by the way, raising your hand, because you have recommended I should get in touch with Caroline. So that was a very good hint. Thanks. So Ylva, you have to switch.
Thank you, Martin.
Ylva, you have to switch on your microphone.
Sorry. Thank you very much, Caroline. It's very good, very nice study. It's a large amount of work, I think, in this study, right? So I was wondering if you had any comments on how did the women who sort of you led by the hand more than just motivation, how did they experience the exercise? And the other question I have is, do you have any thoughts on how you could make your motivational speeches more effective? So what is lacking in trying to motivate people? Why is it that they're not really responding? I think this is a general thing. It's not just these moms, but it is a general thing. So you want to comment on that?
Yeah, thanks for the question, Tulva. They are very relevant. And yeah, so we saw that so the data I just showed you that was average physical activity levels, and these were of course driven by that some participants, if we just focus on the structured supervised exercise training group, around 40% of the participants did only show up for less than one session per week out of the 3, like as an average over the whole period. And around 30% showed up for 1 to 2 sessions per week, and 30% for 2 to 3 sessions per week. So it was rather mixed, and actually we only unfortunately succeeded to have around 30% showing up for 2 to 3 sessions per week, even though we offered them 3 sessions per week. That was sort of how the intervention was designed. So there is obviously a big gap, and even though many of them really wanted to, I think we also did a lot of qualitative interviews, and what they say is that it's there are different things that like sort of come in their way when they have to actually show up. And one of the big things are like practical family logistic, getting the everyday life to run smooth, and to get the training fitted in 3 times a week. That's actually difficult for them, even though they try to really think about how they could do it before they signed up. And yeah, so but yeah, so that's definitely one of the challenges, and being even more. So we offered exercise training 7 times at 7 time points during the week, so they could sort of just choose whenever fitted best. So it was not only 3 time points, but being even more flexible, maybe offering them both exercise trainings where they could show up, but also if they have, for instance, a few weeks where it's difficult, then to have them go to the local gym with a plan that we made or something like that. So really to attach them to a contact person and follow them in a flexible manner. I think that's a way you could modify our interventions and maybe make them more effective. And that also partly answers your question B, I think, because I think counseling them, or we can see from this study, counseling them alone is obviously not enough to increase their activity levels. So I guess it's good to offer some kind of training, that they can show up to. Yeah.
Thank you. So just a follow up to there. Do you think there's still some fear in some of these women that exercise is not going to be good for them, that it's actually going to be harmful to the fetus?
Yeah, it's a good question as well. There's definitely still a lot of myths, and many of them come with these fears. But luckily, it was nice that we experienced that when we counseled them and when they were training with us, they felt safe. I mean, you should have seen what we made them do in these gyms. Like they jumped, and they like, I think we could have made them do handstand or whatever if we said like. So I think being counseled by the hospital system or like that made them feel safe actually. So I think that was not that big of a problem for the ones that actually like sort of showed up for the study. But of course there can be a big pool that didn't even like sign up for the study at all because they fear exercise. Yeah.
Thank you very much. Thank you.
So thanks, Uwe, for this question as well. I would just add as a follow-up idea or comment. So I would like to see a similar effort for women, typically women or girls with scoliosis, because it's a very similar topic in a sense, because it's an under-researched area. It's a very vulnerable group. There is a lot of anxiety to do sports or exercise because it may be harmful, and it's probably completely wrong, but no one knows about the right dosage and how to get the motivational package out there. And maybe one can really benefit from the experience you have made so far, what is working, what's not working, and try to move it into a related field somehow.
Yeah, that makes sense.
Okay, so then, Caroline, thanks a lot again for your talk and for being able to prepare this and show us this impressive set of data. And then now let's